love a swan more than most people in this world, but you don't have to have a Swan-Ganz catheter to understand what's going on with your patient hemodynamically all the time. Let's chat about it. So today we're going to talk about how you can know what's going on with your patient hemodynamically even if you don't have a Swan-Ganz catheter. Maybe you work in a place where they don't even have them, or maybe you work in a place where you're trying to decide if you should put one on a patient. So let's chat about what you would see if you had a patient who is starting to decline hemodynamically without even being able to look invasively at the patient. So we're just gonna use our basic nursing skills to look at our patient and think about what it looks like as the patient's cardiac output starts to decline and how the body will shunt blood to the most important things. So if you are doing an assessment on your patient and you start to see signs that their skin is not getting great perfusion, you're going to see things like the patient's may be clammy, the patient's skin might be cool, something like that. That is the beginning stages of cardiac output issues. The other thing that you might see is that the patient may start to also have some slow GI mobility. So they're not getting great perfusion. The body is not super worried about digesting food right now. So instead it's focusing on more important things like keeping the person alive. And you're gonna see things start to shut down GI wise. So you may see an increase in your NG tube outage if you have an NG tube in place. You may see diarrhea or constipation. As cardiac output continues to slow down, the next signs that you're probably going to see are going to be related to the kidneys and to the lungs. So as you're just doing your basic nursing assessment, you're looking at your patient, you may see that the patient's urine output slows down. At a lot of places, we do it in milliliters per hour, and most places will say if it goes to less than 30 cc's per hour, that is too much of a decline. And we should be notifying providers. So is your patient's urine output starting to decline? Is your patient's creatinine going up if you're checking serial labs? Are you seeing that increase in creatinine? For the lungs, you might see shortness of breath, increased work of respirations, increased respiratory rate and shortness of breath. So if you see signs respiratory wise, after you've already seen these signs from maybe the GI or the cool clammy skin, and now you're starting to see lung and kidney involvement, that is showing even more your patient is probably having some cardiac output issues, even if you don't have a swan. Hemodynamically, they're not doing great. And finally, hemodynamically, we're going to see, even without a Swan-Ganz catheter, signs of brain and heart involvement. Now that might look something like the patient having decreased level of consciousness, their pupils may be sluggish, cardiac wise, they may start to show symptoms of an MI, they may start to have chest pain, we may see ST elevation, we may see increased ectopy, we might see an increased or decreased heart rate. So that's just some ways that you can look at your patient and use your basic nursing assessment skills to know what's going on with your patient hemodynamically, even if you don't have invasive monitoring. So continue to follow this series and we'll continue to talk about all things hemodynamics related.